you spent time in finance, but then when you got to Vanguard, you had a chance to see the business side of healthcare a little bit more completely. What were your first thoughts about healthcare? Anything surprise you about actually working in healthcare at that point, Travis?
There were a number of things. I mean, the first thing that surprised me was that how much I genuinely enjoyed being on that team, right? I said, if Vanguard had continued into existence and hadn't been acquired by Tenet, I could have worked there the rest of my life. I loved learning from that team. Keith, as my boss, was an amazing person to learn from, Trip Pilgrim. But as the person who was tasked with, doing in essence the underwriting for these acquisitions, I noticed the lack of sustainability with specific respect to the financials of not-for-profit health systems. Right? Like I would pore over these financials and I would see that they were losing money on the overwhelming majority of admissions. And that, that was specifically confined to Medicare-related businesses, right? Whether that was fee-for-service or Medicare Advantage. And just thinking to myself, how this is not a sustainable business, right? Like when you notice that not-for-profit health systems typically generate margin on investment income, having a background in capital markets, if that investment income isn't there, they don't have profit from operations to drive sustainability. And so that was just a overwhelming eye-opener for me from my time at Vanguard.